very much.
Yeah, thank you very much, Vivian, and it's a good afternoon, everyone. And it's a privilege to be a part of this occasion today, marking the 60th anniversary of our country. And then also using this auspicious occasion to talk about something that is quite important for our national development, which is nutrition. So I will just build on some of the issues and points made by the first speaker as I take us through around some of my thoughts on how we can all reflect and look at how far we've done well and what are the issues in seeing how to create an enabling environment for nutrition in Nigeria through policies, plans, and strategies. So permit me to stand on the existing protocol. The next slide, please. And so what we want to see in the first few slides of this presentation is already well known. But my biggest point here is that the issue we want to solve and we're discussing and we are coming around for is extremely important. And this, what you see here is a cartogram that the World Bank Group helped to develop. It's trying to see how malnutrition is in Nigeria. But the big thing is that progress has been happening over time, but the pace of change is still slow. And that makes us still be the country with the largest number of minorities, country with the second largest number of minority children in the world. And we know that about 50% of child mortality could be attributed to malnutrition as an underlying cause. We lose a good part of our GDP, and the consequence is very impactful. Let's go to the next slide. I try to illustrate the damage that malnutrition causes in further justifying why this is an important national priority. And when you have a good proportion of the population of a country handicapped by the biological consequences of malnutrition, that's quite huge. And what you see here is the brain of a nourished child and a malnourished child. And you can see the difference. And if a good part of a country and children are in this situation, it becomes quite challenging. That's why we need to see how to make our policies, strategies, and plans are more effective and how we move that with a greater sense of urgency. The next slide, please. The next slide still emphasizes this message and using one index of malnutrition, which is stunting, to say that if we can reduce malnutrition, it can impact all aspects of our national life. The rate of mortality will be down. Our our contribution to GDP will be significant. And we'll have a people who can contribute to a knowledge economy that we're going to. And that's why it becomes important that our policies, plans, and strategies will help locate us where we ought to be in a knowledge economy and within the context of the fourth industrial revolution as we make progress and as we go forward. Next slide, please. So I have 2 slides remaining in this presentation, and I'm going to dwell a little bit on these 2 remaining slides. But as Dr. Moma pointed out, she tried to mention a number of policies and plans that we have. And there is a journey in this policy process that the country has passed through over time. And from early independence, when we have the Department of Human Nutrition in the University of Ibadan, in those early 60s, then we started moving on along the line, and stakeholders started coming together to see the need to develop a nutrition policy for Nigeria. And after that 1992 International Conference on Nutrition in Rome, it became quite important that Nigeria should have a coordinated national policy on nutrition. And those activities happened until in 1995, until in 2001, when we now had a finally launched national policy on nutrition, which passed through some revisions and leading us to where we are today with the first policy on nutrition from 2016 to 2025. And then we started having the sectoral policies that respond to the national policy. And besides this, both in health and in agriculture. And we have also several guidelines and plans that are determined to help support a progress in nutrition in Nigeria. I would say that substantial progress has happened from the 60s down to the early 90s and to this point in time. The level of visibility has increased significantly, and government has shown much commitment around understanding what the issues are and providing the fundamental support from a policy point of view. And so you could see, if you look at Nigeria and a few other countries, you see that from a policy environment point of view, there's been some concerted attention paid to the issue of malnutrition. We have also structures that have been established in response to policy recommendations. And one of them is the National Council on Nutrition, which is a policy structure, the highest policy council that we currently have on nutrition, chaired by the Vice President. And the Office of the Vice Presidency also supports a lot of other platforms that are crucial for advancing nutrition from a policy and programmatic point of view. You have the Central Working Group on Human Capital Development. You have that National Food Security and Agriculture Council that are critical for nutrition. And so these are all opportunities that we never had before. Even in terms of financing, it's still quite low, but you see that progress has also been made. Budget lines are being created. Sometimes resources are allocated, and sometimes they are released and sometimes not released. Those are all part of the journey. And then with more efforts going in raising advocacy and engaging government at a high level. So we can see also the Nigerian joining the Scaling Up Nutrition movement in 2011 are all key symbolic and strategic policy actions. The appreciation that the government has on the role of nutrition in meeting its human capital development objective is also something quite positive. We see the Vice President being physically present at the National Council meetings where nutrition issues are discussed, and then oppositioning himself to play the role of the chair of the National Council on Nutrition. This administration also sometime developed the Nigerian Industrial Policy and Competitiveness Council, where you have the Vice President as a chair, and you have a private sector and a public sector partner as vice chairs, with all key ministries being part of that. We see government supporting data and evidence generation issues. So we could see that things are happening. It's just that the pace is relatively slow and not at the level and with intensity that matches the enormity of the challenge. And so at a 60th anniversary activity like this, it becomes a time to reflect and also to review. And as we look backwards, we review where we're currently and see how we can go forward. And that's why in the remaining parts of this slide, I've tried to come up with a model that will help us to reflect a little bit more on what improvements we can make in looking at creating a better policy and enabling environment towards advancing nutrition. Next slide, please. And so here, the model I use here will be familiar to a lot of advocacy folks who are principally the audience in today's meeting. And this model was not originally intended to apply to a broader set of policy plans and issues, but rather issue-specific things that you can apply and think through and see how to advance. But I decided to pick some elements of this model to see how we can see opportunities for improving our policy development and implementation processes. And those are the places where we have a number of issues. And then one part of this is that we need a well-defined narrative. And this is quite important, that our policies are better defined by a coordinated narrative that talks about the urgency of nutrition and the dynamic nature of nutrition and the multisectorality of nutrition and other associated aspects that are very crucial for us to make our policies, plans, and strategies work better for us on the issues we want to solve for. You discover that the narrative is still not quite clear, and we have a responsibility to ensure that our future policies and plans or implementation processes take care of that. We need to create that harmonized approach that brings all critical systems together, the health systems, the food systems, and the social protection systems, and sometimes the community systems together. And the major point is that all systems matter, and that's why we need that approach. If you look at the conceptual framework of the causes of malnutrition that UNICEF developed in 1990, it was very clear on the immediate factors, the underlying factors, and the basic factors. And that provides a point of convergence for all kinds of systems that are crucial. And we need to be more intentional in ensuring that our policies and strategies take note of that. While we have our traditional nutrition policies and instruments, like the National Policy of Food and Nutrition, the Agricultural Sector Food Security and Nutrition Strategy, and the NSPAN, the Strategic Plan of Nutrition in the Health Sector, which is being revised. We need to see nutrition get more visibility and get more engaged around in other mainstream policies. If you look at the National Health Policy, you don't see, it doesn't reflect the priority of the health sector for nutrition. That's why it's mentioned, it's present, it's part of it, but it needs some more attention. If we look at the mainstream agricultural policy, we need to get more engaged around nutrition. So that's why we need to do more in ensuring the connectivities. If you look at the educational sector, which has great relevance for nutrition and a key stakeholder, what that sector needs to do for nutrition and what it brings to the table is still not well defined. And we lose opportunities to get political capital and resources when we don't address some of these issues. So this is one important thing we need to do in defining that narrative. And a little bit more is that when you look at major national instruments like the Economic Sustainability Plan or even the Economic Growth and Recovery Plan, you didn't see nutrition coming out quite well. And sometimes it's still assumed that if food security is addressed, nutrition is automatically taken care of. It's a partial truth that we need to build a narrative as advocates and stakeholders that helps governments to better see how to build more robust policies that can help us advance the nutrition agenda more. Another part of this enabling environment framework is feasible solutions. We have been developing and evolving how we go about and advancing our policies and strategies. But there is still an opportunity to focus more on feasible solutions and advance them. And one part of that is that how we use evidence to influence our policies and how do we set our objectives, and then how do we prioritize the combination of strategies and interventions that we need to take forward. There is a policy, there's a decision science tool called Optimal Nutrition that the ANRIN project through the Ministry of Health and the World Bank as a facility to bring in such that you don't just set objectives, you link your objectives to the most feasible interventions, understanding how they will impact what, and the financing requirement that is needed. I think this will be quite useful so that when we set policies, they'll build them around feasible solutions, and we create the right plans around them, financing plans, evidence support, that makes them implementable. And then also, one part I want to say on this is also the capacity development. We've seen the capacity deficits across all sectors for implementing nutrition. When we started working in the Ministry of Agriculture, we got the Food Security and Nutrition Strategy. But how do we implement that? We discovered there are serious capacity deficits. And then we started working on a nutrition workforce strategy for the agricultural sector. We now realize that we need to take an organizational development approach if we really have to make a headway and get more stakeholders involved, and then deepen engagement across several domains. In capacity and feasible solutions, you also need to build leadership capabilities that will make people take the right actions and lead from where they stand in advancing nutrition. This is some of the challenges I think we'll be able to organize ourselves around in improving our policy development and implementation processes. I know my time is going, but I want to also talk about having a clear path for resources for implementation. Our resource plans are many times deficient when we have strategies, and it affects who is going to bring what and at what time, and what is secure and what is not secure, and how will it be guaranteed or not. And that's why we have great policies, but the financing plans do not allow for effective implementation. Advocacy remains critical. We need advocacy in different areas. Data advocacy, to make data a priority and to finance data that supports policy implementation, also helps in tracking accountability. We also need advocacy for more funding. We also need to mobilize the public to understand the policies and engage them effectively. And we also need to cultivate champions. Finally, on cultivating champions, that will help us drive accelerated progress in implementing nutrition policies. We need to be intentional about who our champions are, and then create the right platforms for our champions with clear deliverables and resourcing them effectively, and then so that we can realize that. So it takes a whole lot to see the kind of changes we want to see. But as I finalize, there's progress already, but there's so much more we need to do. And I'm happy to discuss more as we interact through this session during the questions and answers. Thank you very much.